All right, everybody, welcome to this community discussion. Of course, I'm Mel Raposo. You got Charlie Iona, Senator Kouchi, and a bunch of other friends here. We're actually on live as well. Patsy's monitoring my Facebook Live because we don't see the comments or the questions from the Facebook viewers, which I imagine will be quite a bit. And I don't see, we do have a chat window in this, but I'm not going to be paying much attention to it because we have the ability. If you have a question, if you have a concern, or if you have a story to share, all you do is hit that raise hand button on the bottom, and then I will unmute you, and you get to share your story or ask your question. I just ask that this is not a bashing session, a blaming session. This is really an opportunity. I felt I have been bombarded, as I know some of you, the others are, with questions, with comments, and through the last few days or the last week or so, I've been able to get a lot of questions answered, but things change every day. So if you have a question, feel free to ask. This is really, like the title, it's a community discussion, just for a bunch of us that cannot, because of the rules, that we cannot hang out anymore. This is an opportunity for people to get together electronically. I have asked a few people. We have Senator Kouchi with us, and I appreciate you coming on, Senator. I know Senator Kahele from the Big Island just texted me back and asked for the code, so I'm assuming he'll be on, as well as the mayor. But this is an opportunity to get a update from our mayor, and I'll turn this over to the senator real quickly. We also have Charlie Iona. Okay, hang on. Okay, that was Senator Kahele. So he asked when was it going to be? I said it's on right now, so you got to come on now. But yeah, just so Senator Kouchi can give us a quick update as far as what he's seeing on the state level. We got Charlie Iona, who's been very active as far as sending out information via Facebook as he gets it. And anyone else, if you got a question, please feel free to just raise your hand and we'll get your question answered. So let's start off right now, Senator Kouchi. Let me go ahead and you're unmuted, so you can just go on and share what you got, my friend.
Thank you, Mel. First of all, we were on a conference call with Senator Schatz, Senator Hirono, the governor, his chief of staff, House and Senate leadership on Friday. But if you go to the legislature's website and you check on the Senate, we do have the committee into the COVID-19 response, and at 11 o'clock or 11:30, Senator Schatz via phone had given pretty much the same report. As you see now, he is sending out briefing papers daily as he and his staff go through sections of the bill explaining just what is available and what might be relevant for the residents here in Hawaii. I talked to him this morning and I did mention if he could have the section relating to your 401k access broken down, and if he could get it sent out earlier. I heard from one businessman on Kauai who already accessed money from his 401k so that he would be able to keep paying his employees. He used the loan provision in his 401k. There's also a hotel worker who talked to me on Friday and also was saying, can you get to your 401k? Have they relaxed the rules? As far as what I've read, you can take up to $100,000 out of your account. And if you're younger than 59 and a half, you don't pay the 10% early withdrawal penalty. And then you have up to 3 years to pay back the loan, and you would not have any tax consequences. If you do need the money and you can't put it back into your account, then they will spread your tax liability over several years. And then for the straight borrowing, instead of the limit of 50,000, they were raising it to 100,000. I asked Senator Schatz to confirm that, but I know a lot of our employees are good savers that were preparing for retirement, and so their 401k may be an avenue to get money. especially if you're worried about how long some of the relief is going to take to get to you. This would be a convenient tool where you may be able to access your money sooner. If you are in a 401k, I suggest that you maybe start finding out what it would take to access it. Are you managing your account online? And would you be able to do it that way? If you need to either fax or mail in the forms, you should start inquiring about getting the forms so that you give yourself as many choices as you have available. The second thing, and I'm a little ashamed of what I'm going to tell you now, but I'm going to kind of rat myself out, but Joy had left for me on the computer desk the Census 2020 form that I need to fill out for the condo here in Honolulu, as we are part-time residents. And I have been pretty busy on Zoom and conference calls and other kind of, returning messages that I never got around to it. So after I watched New Hope Kauai's service this morning, I sat down and did my 2020 census form. For those of you who haven't done it yet, or those of you who have a broad reach, make sure you reach out to your friends and family, get them to fill out that census form. It means so much money for us here in Hawaii, and it is going to be more critical than ever that we don't leave any of the federal dollars available for us on the table. That's the current report, other than, the committee will be meeting tomorrow morning, between 11:30, 12 o'clock. So it'll be on the legislature's website. The House Committee on Recovery is going to be meeting tomorrow. I think that's at 10. Both of those meetings would be live streamed. I think if you go to the legislature's website, you'd be able to find out the links and how to go to it. I know the committee meeting of the Senate was on Olelo Hoiki, on the public TV besides Facebook Live or YouTube and other links. And so we have worked, and with Olelo coming on, we finally have a better picture quality and better sound quality. The first couple of meetings were a bit challenging to get done, but Fridays was the best.
Thank you very much. Thank you, Senator Kouchi. I have one question. I know Senator Kahele, welcome, and thank you for joining on. I know you only have a short time. You have like 15 minutes or so.
Yeah.
I did have a question for Senator Kouchi. This came in on Facebook. Is this on the 401 loan issue that you talked about? Is that only for those with a 401 with a loan provision?
Two things. Provision is capped at 50,000, so they are going to increase the loan amount to 100,000 from what I read. But second, they will let you withdraw early from your 401k up to $100,000. So you don't even have to take it as a loan. If you keep the money and you don't pay it back, then you will be taxed for the ordinary income, but you won't pay the 10% early withdrawal penalty. Now, if you're like me and over 59 and a half, you wouldn't have had the penalty anyway. But anyhow, you can get to 100,000 without the early withdrawal penalty. If you pay it back, then you can have had access to your money as an interest-free loan. There will be no taxes assessed. At the end of 3 years, what you can't pay back, you will be taxed, but that tax will be spread out over several years, at least based on what I wrote. And I would wait till you see the information from Senator Schatz to be exactly clear of what you're doing, so you don't have any kind of adverse tax consequences.
Thank you, Senator Kouchi. So if you don't have a loan provision, you can withdraw up to $100,000 from your 401k without the early withdrawal penalty.
Correct.
Okay. And then the big question that I know everybody's dying to ask, I haven't seen any hand raised, but I know Charlie and I both have this question. How are you guys doing, the two senators? I know you folks both were had contact with Senator Nishihara and were tested. I know HIPAA and all of that stuff, but I know that I've watched both of you. I've watched Senator Kahele's Facebook Live as well. And those, they really help us. But how's everything going? Senator Kahele, we'll start with you. How's everything going up there on the Big Island?
I mean, I'm fine. I tested on Saturday, this last Saturday. So, I'm at day 8 right now. I know Senator Kouchi, I think he tested on Thursday. So he's probably at like day 10. No results. I have not received a phone call. Myself and Senator Kanuha, we tested same day at North Hawaii Community Hospital in Waimea. And I have not got a phone call back or any results, which is very, very frustrating that 8 days later, we don't have a test result back. And that has meant that, we've basically had to self-quarantine for the last 8 days as much as we can. Other than that, my health is fine. I feel fine. I have no flu-like symptoms. Never had them. No fever. I expect a negative result back, just like some of our other senators. I think the other senators that have been tested, Senator Inoue, I know for sure has got a negative result. So that's probably the most frustrating thing for me.
Senator Kouchi?
Same thing, but I'm in day 10, and there's a simple explanation. Half of our tests were sent to clinical labs and half were sent to diagnostic labs. Clinical labs has been turning their tests around about 3 to 4 days, which is in either North Carolina or Texas. And with the backup, I guess, at the diagnostic facilities, I've heard 7 to 10 days. I hope it doesn't become 7 to 11 days since I'm in day 10. The other thing on the Friday meeting, though, Dr. Anderson did say to the committee that they have now gotten labs certified on Oahu. So if we had been tested this week, as opposed to last week, Thursday, they are now able to get the results turned around in 2 to 3 days because they no longer have to ship a lot of these results out to the mainland. Whether they're still shipping or not, I don't know. I didn't catch that part because I know they did a large test in Waipio yesterday, and a large test is going on at Kaka'ako, and they are trying to get out to all of the neighbor islands again. If they're able to handle that volume here, then at least those participants should get results in a more timely fashion.
Yeah, I would echo the same thing. There is a difference between clinical versus diagnostic and getting your test results back. In hindsight, having now been, this is day 8 for me, what I would have done, and I don't know if this is possible to do, but what I would make a recommendation on, because I am in the Hawaii Air National Guard, like you were, Mel, and we often get urine tested during weekends. They're very methodical about matching your ID with your name and your number of your test. If I was akamai enough that day, I would have made sure I took a photo or I got my number for my test so I could track it or I could follow up. And I didn't do that. And, I would have done that in hindsight, and I would recommend it for anyone that does take a test that you get the actual number that was assigned to you when it's sent off. So that's something you can follow up with. So for now, I wouldn't even know how to follow up with my test if I had to. If this was day 21, I wouldn't know what my number was.
All you have to do is 14, Kai.
Yeah.
All you need is 14 days.
Well, that's right. So it's actually, is that the policy? Is that the policy, Senate President? If we hit
Yes.
14 days, we have no word, then we're out?
Yeah, it's a 14-day self-quarantine if you came into contact. That's why when you have for people who are arriving on the airplanes, the 14-day quarantine is the CDC policy.
Okay. So once you hit day 14, you're out of jail.
Yeah, the other thing that we can assure you, there have been no favorable treatment to any of our tests. We're in the queue like everybody else, patiently, maybe not so patiently waiting.
Right. Yeah, we're not being treated any differently. Come on, Mel. I can guarantee you that.
Well, that is very obvious, and I know they had some discussion about that at the Senate hearing, which I watched, and I appreciate those live feeds. I know I have a friend on Oahu that actually lost his. They lost his test, and it's unfortunate. The volume of tests going through, and it's something that we just don't do. This is something new, so it's just unfortunate though. And Kai, good advice. Take a picture of your sample paperwork. Get that number so you can follow.
I mean, even like hypothetically, if your test came back positive, right, you would want to make sure that guarantee there was no swap or something wasn't lost, or you would want to make sure that that's either way that you have that number. I would recommend that if they allow you to keep that, because I never got a hand receipt or any type of paperwork for my personal test. So just advice from somebody who's gone through this now.
Awesome. Somebody just posted a question about the census forms. They didn't get anything in the mail. I would just go to the census website and let them know. There is a link that you can click to let them know that you didn't get your form, and they'll send you one. We took care of ours already, and I encourage everybody to do the same. We see Brother Khalil Perez just jumped on. Charles Iona.
Yes, sir. Yes.
How are you doing, Charles?
Well, I'm going on day 30. Nobody told me about the 14 days. So
released, brother. You're released.
Yeah. So I'm just afraid to walk out in public because when you stockpile in everything except razor blades, it's a tough call, boy. A question for the senator, Kouchi. Why did the certification process for the lab take the length of time that it did take, Senator?
Well, the normal process is 3 weeks. And when it started really getting big in New York City, Senator Gillibrand from New York, the junior senator, was on CNN. I happened to catch her being interviewed, and she was complaining that it's 3 to 4 weeks, and the CDC had to find a way to speed up this process. They have expedited the process now to stand up the labs, but when they were initially trying to get certified both clinical labs and diagnostic labs here, it was still a 3 to 4 week process. I believe it's been modified now. And then they have gotten new variations of the test, which are yielding results, some as quickly as 15 minutes.
Because, some have asked me that. I'm glad that you came on today that we can clarify that, because I know that if we lived in a society with isolation, like how Hawaii is in the middle of the ocean, that we kind of would think that, plans are made that should a pandemic, whether it's small or big, you would have to handle the masses. I know working at the medical examiner's office, we were planning years ago for something like this. So, getting equipment in case we had to, roll out a rolling morgue, something that you normally wouldn't do in buildings, and take it out to the scene, commandeer a field, have everything done there. We were prepared to do large numbers. So I was just kind of curious if, and I guess this would be a question of speculation, if the state really thought something like this could happen, or they wasn't prepared for something like this to happen.
Most of our disaster exercises have been along the lines of dealing with the hurricane, or I know we've had a few at Lihue Airport where, one of the planes would crash coming in for landing. So it had been focused on the disasters that have either hit us or, as island community with so many airlines coming into our airports, being ready for something that was more likely. I can't comment on, something like, the flu being at that particular level, or, getting to this pandemic level. I'm not aware that those exercises were done.
Thank you, Mel. I think answered some questions that I had pertaining to this and the certification process. Thank you.
Right. Well, for those of you that are on Facebook Live, we're going to get a lot of good information on this. Mary's going to be coming on a little bit. We got a couple of senators on. I know Dee Morikawa said she's on. I cannot find her on, but let me just see. Maybe. But anyway, I expect more people. But we're gonna have a good discussion. So if you're on Facebook Live, go ahead and share it. Do a share party or a watch party or whatever it's called, because I think it's important that we get accurate information out there. And I do have some questions here. One is really as far as community spread, and let me just the lieutenant governor mentioned that we were having community spread a while ago, and I think some people mistake community spread. We all know most of the people that get infected are getting it either from traveling to the mainland or picking it up from a traveler from the mainland. But once we run out of trips and we run out of tourists, then the exposure is going to be community driven. It's going to be basically transferred in the community. I would tend to agree with the lieutenant governor that the community spread is already occurring. We may not have evidence, and I know on Kauai, it's either been a visitor driven or a resident that went away and came back with COVID. So, but I guess the point I'm trying to make is that the community spread is here. All of these people that come back and are carrying this virus is spreading this virus to everybody that or potentially spreading this virus to everybody they come in contact with. So people need to understand that maybe because we haven't had any evidence of community spread here with the tests so far, we still have a ton of tests. Yesterday, Kauai alone tested over 40 people from one person that had contracted the virus in Las Vegas. So we don't know how many tests are out there. We don't know how many tests are pending. And until we talk to the person that gets infected, we don't know. We need to assume that community spread is here and that this virus will be spread via the community. And that's why it's so important, and I'm going to take this opportunity now because I can. And it's very simple here. And I think you all agree. This is the deal right here, people. That's it. Wash your hands. Cough into your elbow. Don't touch your face. Keep the proper space. And 6 feet is kind of a conservative, stay further if possible. And of course, stay home if you can. That is what this is all about. And we need to take that seriously. I think a lot of people are assuming that, in fact, this isn't as bad as it is, but it is, and we just gotta take it serious.
Mel, can I ask you something? I just was gonna say, I know that Senator Kahele's got to get going soon. I didn't know if he had anything else he wanted to share before he leaves, and at least I'll get a chance to say, nice to see you, Kai, instead of just sharing a text or a phone call. And happy belated birthday.
Hey, mahalo nui loa. Thank you very much. It feels good to be 46 years young.
The floor is yours, Senator. Floor is yours.
No, I mean, things are going well, at least the best they can here on Hawaii Island. I think what's frustrating for us is we have different counties doing different things. Mayor Kim doing the best job he can, but his policies have been a little bit different than the other counties. Mayor Kawakami is taking a different approach. Mayor Victorino's got a different approach. And so that's been a little frustrating for us here on Hawaii Island. We're just trying to manage. We got hundreds and hundreds, if not well over thousands that have been laid off this week. We have a big hotel industry on the Kohala coast. And so we're dealing with that. A lot of ILW members out of work and are hitting the unemployment lines like everyone else is. Some of them, their medical is on the line. So I've been trying to work with a specific hotel to keep their medical plan going. Some have generously given 2 months, which seems to be the standard. Others, one other hotel has given their members 3 months, and just the uncertainty about our economy. You know, we have been very proactive. Our Hawaii Island delegation, which numbers 11 members, Senate and House, have been meeting every single day at 10 a.m. on Zoom. We have also had side meetings with the nonprofit organizations that are boots on the ground right now, doing things in our community directly related to the COVID-19 response, primarily helping our keiki, our kupuna, our houseless, our homeless, our families that are struggling, those that are missing meals, and then our first responders, our healthcare professionals on the front lines. We can't say, you know, thank you so much, thank you enough for everything that they're doing. You know, if there are any nonprofits on the island of Kauai, I would that are doing you know, projects right now, I would love to get that information. I launched a website, an entire page dedicated to COVID-19 on my website, kahele.com. It's got a lot of great information on there. I dedicated one section to the different islands and nonprofits that are helping right now. So besides the food bank and the Kauai food bank, Mel, if there's a nonprofits that you know of that are doing things on the island of Kauai, I'd love to feature their link on my website. And then tonight at 5 o'clock, I'll be doing what you're doing, Mel, which I think is a great service for our community, just to get the information out there. So from 5 to 6, I'll be doing a Zoom, Facebook Live, and I'm going to feature Hilo Medical Center's Chief Executive Officer, Dan Brinkman. We're going to talk about healthcare for the first 30 minutes. And then I'm going to bring Esther Kiaina on for the last 30 minutes, and we're going to do a deep dive into the Federal CARES Act and how that specifically will affect people on unemployment, people that might need to go to COBRA or Quest, what that federal program is going to be offering small businesses. So that'll be in a few hours from 5 to 6. And unless you got a specific question, that's kind of my update. We're hanging in there like everybody.
I actually do, Kai, and it's our Senator Kahele, I'm sorry. And I don't know if this is even for you, but there's a question for you. What happened on Mayor Kim's midnight deadline from the county council? I'm not aware of that, so I can't answer that question, but was there a midnight deadline?
I'm not aware of that. You know, we've been, the delegation, if there's one thing that this has done, it has brought together both the House and Senate and our delegation on Hawaii Island to work very closely together. We have sent collective voice letters to Mayor Kim, everything from his decision to close the parks and restrooms and potentially create a health crisis with our houseless and our homeless. Here on Hawaii Island, he's had different policies in terms of the stay-at-home order and what's an essential worker, not an essential worker. And so, you know, I don't know what that that midnight deadline to the council was, but, you know, we've been working together with the council as well. We have had a few of the mayor's representatives on our call, but the mayor himself has not. I have not had any interaction with Mayor Kim, and he seems to be operating basically on his own at the Emergency Operations Center with his team, of course, as well. So, you know, we are here to support the county and do whatever we can do. But I have had good conversations with the members on the council.
Thank you, Senator. Yeah, and I don't have information on that as well. I understand what's going on Big Island, but I was not aware of that. So sorry, whoever you were, I cannot get that specific question answered. I know I mentioned D. Morikawa earlier. D, please join us on Zoom so we can get your input like we do with these senators. If you just go to my page, the link is there. I don't have the link number right here, but yeah, just go up and you'll see it. It's just click on that link and you can join us here on Zoom. Are there any questions from people here that are on the Zoom discussion? There's a bunch of you here. Just go ahead and raise your hand if you have a question for anybody here on the panel.
Mel.
Yes,
Mel.
yes.
So
yes.
I think we probably should have started at the very beginning by saying President Trump had a press conference at noon Hawaii time. In the press conference, he is now recommending that everybody stay at home as much as you can through the end of April. So the Easter would be a great aspirational date, is off the table. Dr. Fauci, Dr. Briggs have apparently given him some models that shows if we reopen too soon, the catastrophic situation that might occur, and deaths may exceed 2 million if we were to do it. And so he has now publicly stated, the stay-at-home order should be in place through the end of April. So to Mayor Kawakami, who did say, I may be viewed as taking too strong of a stance, but I think this is what is necessary. Everything seems to be validating that Kauai is doing things the right way. And as hard as it seems now, they're trying to do the best to ensure the safety of their residents. And with what the president has said, I think this will now line up where whether you're in a public school, you're in the state, county governments, April 30th is the date. We're all working off the same date, and we need to plan accordingly. And we need to make sure that we limit our movement and follow, the 5 items you said. And I've touched my face at least twice since you put the poster up. So I'm trying to hold my hands in my lap and not do that. It's very difficult, but again, what we need to do, and it seems like we're all in sync with the medical leaders of our nation.
Thank you for that. I mean, I think everybody wants to see the country open by Easter. I think that's a very optimistic outlook, but I think in reality, it's just not going to happen. I think we all know that. We did have a question, Tammy.
Hi, Mel. Thanks for having me on here. So my question is this whole quarantine. So the 14-day, I was told that there was no flights coming in, but Iggy posted that there was. And I've already spoke with you about this, but I wanted to get this out and about. So how is this quarantine really working? Because the honor system doesn't work. So if we're only checking up on the 2 tourists, what about the residents? I put my daughter in self-quarantine prior to the mandatory, but if no one's checking up on them, I just don't understand what the point of quarantine is. And if we continue to let inter-island people keep coming over, nothing's going to change. We're going to continue fighting this virus. And I'm just trying to understand how this quarantine thing is working.
I can only tell you what I know. We have the quarantine in place, obviously, a 14-day quarantine for all visiting or arriving visitors and residents. The question is really, how do you enforce that? That's the problem.
Right.
I think that's the question. I think there is discussion right now at the governor's level of whether or not we're going to stop the incoming flights, inter-island flights. I don't understand. I think we didn't really have a plan ahead of time with the quarantine, and you see conflicting reports. You see conflicting reports from the government that says nobody landed on Kauai. We got conflicting reports saying that there is absolutely no one landing, and we know that's not true. I mean, we all have friends or family that work at the airport. We all know that we have visitors coming into Kauai, and what's happening is they're connecting out of Honolulu or Maui or Kona, and they're coming in on an inter-island airplane and making their way to Kauai. The reality though, and there is someone here, and I'm gonna ask him if he wants to comment. He works at the airport, and his information is a lot of these flights are coming in empty. They're coming in with just a crew or 1 or 2 people. And I think there's this perception. I know I got a message the other day that said we had one American airline flight come in with 200 people. United came in with another full flight. And in reality, the United airline flight had been canceled, and the Delta flight had 6 people. That is what I got from the official record from the airport. So I know there's a lot of confusion, misinformation, and it's the bottom line is we got to get a handle on that. And I believe the people deserve to know on Kauai how many visitors came in, and are we screening them? We all see the posts, we see the pictures on Facebook. We hear from the Uber drivers that say these guys coming in, they don't even have a place to stay. They're trying to get into the hotel. The Uber driver drives them to the hotel, and they're not taking any guests, and then they go to the hostel. So I think, and I'm not going to beat this up, but the bottom line is we got to tighten up the enforcement. I've made my suggestions. I think you got to tag them. You got to tag them, put a tag on them so everyone knows they should not be out for 14 days. Quarantine is different from a curfew or a lockdown. Quarantine means you do not leave your hotel room or your residence. The food is brought to you. So I understand the frustration. I really do. And it's I don't see any plans to change that right now. So again, I'll go back to that 5 steps. We got to protect ourselves. Stay away from the tourists. Don't go near them. Definitely don't go near them. And I think the state and the county's got to do a much better job with the enforcement. I thought it was unfair to put the enforcement responsibility on the counties, who's already strapped with resources. But that's above my pay grade, and maybe one of the senators can touch on that. But that's basically my position on that.
I mean, Mel, the quarantine that was put in effect was to severely, make it difficult for people to want to come to Hawaii, and so they would cancel their trips and have those numbers go down. But the only really way to effectively do a quarantine is to do a real quarantine, which is, you would shuttle people to a specific location where they would reside and where they would stay for the next 14 days. But, whether that was a specific hotel or a specific location, that's the only way to truly have a quarantine where people are monitored daily. And this almost curfew that is I don't know, put into place is going to be very difficult to enforce and very difficult to track. One thing I think I do agree the state could do is they should inform the public of the amount of both residents and non-residents that do come into the state and how many are in quarantine. I would like to know how many non-residents right now that started arriving in Hawaii after 12:01 a.m. on Thursday, how many are in quarantine? How many residents, how many non-residents? And I don't think the state is putting out that information. They're doing the best they can. We got good people there. General Hara and others are doing the best they can, but this is this is a situation unlike anyone has had to deal with in our lifetimes. And they're just, we're all playing catch up, and it's a very challenging situation. But I gotta go, Mel. So thank you guys, everybody. And before I get off, I just want to say today is National Vietnam Veterans Day. And so for all of our Vietnam veterans out there, mahalo nui loa for doing everything you do and for serving our country. If you guys know a Vietnam veteran today, give them a call and let them know you care about them and we appreciate their service to our country. And that's it. Thanks, Mel.
Thank you, Senator, and thank you for your service as well. Stay safe, and we wish you well on them test results, both you and Senator Kouchi. And I was just on the phone with the mayor. He's going to be coming on. He's having some little technical problems with the laptop, but he'll be on shortly. So, but go enjoy the rest of your weekend, my friend.
Thank you, everyone. Aloha.
Aloha.
Bye.
So, Mel, I can give you some more information about that.
Go ahead.
As far as flights coming in, again, I need to repeat that the federal government is in charge of the airports and the planes that fly in and out. The state of Hawaii, we own the airport and the grounds that they need to traverse over. So that's why things like the 14-day quarantine, which we hope will be long enough that would discourage visitors from coming, is one of the strongest tools that we can use, but we don't have at the state level the authority to ground planes. If you are able to go to the website for the Hawaii State Legislature and look at the Senate page, the last presenter on Friday was General Hara. And between Friday morning and 4 o'clock Friday afternoon, I know the governor was on conference calls with the mayors. Mayor Kawakami had asked me specifically to reach out to the governor to tell him about his concerns for wanting, a stricter inter-island policy for at least Kauai. I conveyed that to the governor, and when you see General Hara's presentation, he has now said they are going to be taking inter-island measures, but he was not sure how they would all look, and the temporal screening and things of that nature that need to be put in place. I'm hopeful that they've had the weekend to look into it further, and maybe we'll be coming out with more information on Monday. I was talking to Representative Tokioka yesterday. He did go home to Kauai. He hired Bruce Smalley to bring his camera, and he was able to get into Lihue Airport and have video of a plane arriving, videoed the whole process of what forms are being filled out, how the information was being relayed. On Kauai, it goes to Sukanoho. Sukanoho then informs the hotel to expect the arriving guests. Then the hotel security, they have a protocol where they call the room randomly on a regular basis to make sure that that particular guest who should be in the room is still in the room. And with so few visitors currently on the island or in any particular hotel, I think everybody knows pretty much who the new one is that should be quarantined, but that's currently the policy that they're going with. As far as Tammy's other point, I'm not sure what they're doing with the returning residents, and if they are simply on the honor system and should be doing the self-quarantine, but no one is checking in with them or not. And if you listen to Senator Kim, she was asking General Hara about some of the phone apps that are being used in South Korea, so that you are able to get a better idea of where the person on quarantine is and how you can keep better track. And if you are able to get to one of these apps, then for our returning residents as well as the visitors, it would give a much better method of tracking. I believe General Hara's response on Friday was that they had narrowed it down to an app that they're pretty sure that was going to do the job for them, but they're just trying to vet and make sure that it works. But they are trying to find a more advanced technological way of tracking those passengers who are arriving, at least from the mainland for now, and certainly would apply to the inner island.
Yeah, I think the problem with that process is that these, and I spoke of it earlier, is the passengers that are connecting out of Honolulu, they'll jump on a Hawaiian Airlines flight and come into Lihue Airport and walk straight to wherever they need to go, and they're not met by, they're not screened as the person that's coming off of the mainland flight.
They are being screened, and the HTA, from what I'm told, and HTA has been given office space by DOT airports at Honolulu Airport. So when they identify they're going to the neighbor island, the HTA is calling to that neighbor island, alerting them that this visitor is coming in, and that they should be expecting them at their hotel. But you're right, there isn't anybody at the Lihue Airport in our case who would be doing that, but HTA has called from Oahu, is the current process they're using.
Yeah, and I'm assuming that's how the guy ended up in an Uber car looking for accommodations because he didn't have them. So anyway, I'm sure they're tightening it up every day because they're hearing it. I know they're hearing it from the public. I do want to welcome.
I can assure you that they are.
Right, Senator, I watched the Senate committee meeting, and I was very thankful that the Senate committee was asking a lot of tough questions. So the mess they have heard, the administration has heard, and you got to hope that they will be moving that into action. Mayor Kawakami, I do want to, I know there's a couple of questions here, but let me just want to welcome Mayor Kawakami. Let me make sure let me see, hold on here. Okay, Mayor, I don't see a microphone. Can you hear me? Okay, I think you're muted out, Mayor, for some reason. Maybe your laptop, does your laptop have a microphone?
Can you hear me now?
Oh, I can, perfect. Welcome and thank you. I apologize for the last minute request. Oh, there you are. Just wanted to say thank you for joining us today. I know you are extremely busy, so I really appreciate, and I'll turn it over to you and whatever you want to say. And then I'm sure we'll have some questions as well.
No, I mean, I'm looking forward to fielding questions. I just have to say that I believe that we do have the right um, protocol set up on Kauai as far as having a team that is experienced not only in disaster and crisis management because we've been through them. We actually have a very close collaborative effort with our expert in the field of health, medicine, and has experience with pandemics in our Kauai District Health Officer, Dr. Janet Berman, and her team here on Kauai. But in this EOC, 7 days a week with all of us is Lauren Guest and Dr. Janet Berman. We've sort of been very proactive. We have a good team of planners that have been watching COVID-19 since it became on the radar on December 31st of 2019 in China. We use math to sort of formulate how fast it was spreading. We were able to take a look at what some countries have and haven't done, what worked and what didn't work. And we took our guidance from our health officer as well as our first responders, which is AMR, Cody Bonilla, Saul Kanoho, Elton Oshio. We have KPD and the healthcare system as well to come up with what we would say is a hardline defense against the spread of COVID-19. I know that we took some, I guess we had a diverse range of opinions on curfews and our hardline approach as far as taking more of a hard lockdown, not creating too much exemptions as far as what was essential work and what wasn't. We're much more restrictive than the other counties. But I think it's because we've really used information that we do have, and we're using information that we don't have to make these decisions. And you know, right now it's a challenge because look, the best line of defense for this island is for people to take what we're telling people to do and actually do them. We've seen people take it lightly, which I think in a sense, most of us are guilty of. But we're at a point in time where Kauai has a fighting chance. We're the island that doesn't have evidence of community spread. And that's the purpose of having a hardline, stringent stay-at-home, work-at-home order, because the more that we move around, the more this virus moves around. It doesn't just float around jumping into people. It's being moved by the more social mixing and professional mixing that we do. So we're telling people, hey, if you have to go get groceries, go get it and go home. If you gotta go get some exercise, go get your exercise, maintain social distancing, but go home after that, because the less interaction we have, the better first line of defense we have to prevent the further spread of this horrible virus and you know, I gotta tell you, we've been begging from the beginning to let Kauai be able to have the authority to run this island that we see fit, because we understand that every county is unique, and that's the way it should be. And so for even this position that we've taken for weeks now, as far as this quarantine needs to be mandated on all arrivals, because this virus doesn't discriminate between inter-island and out-of-state travel. We took the hard line and said that we need to mandatory quarantine all arrivals, and if kinks need to be worked out, Kauai is positioned to be the guinea pig to see what works and doesn't work. And we're still waiting to be granted that authority. And we have an action plan in place to put that other further layer of protection on which we've already put out there.
Well,
And every day, we're here 7 days a week. And I think the biggest difference is that we, one, we collaborate with our health officer. And, we're always fine tuning the rules. So at this point, we're taking a look at the rules for the stay-at-home, work-at-home order and looking at ways where we can further tighten up some of the flexibility that has been built in. And we do that hour by hour at times.
well, Mayor, thank you. We ran into each other a couple of weeks ago. I told you, you're leading the state. It is very clear in many people's eyes, including some very jealous neighbor island legislators that want to see their counties do what you did. So thank you for that, because I know it's not easy, and the criticisms come no matter what you do. So I understand. And we also spoke about what you was trying to do, and I appreciate your effort. I really do, and I mean that. I just want to, and this question is probably not for you. I will ask the mayor if salons can be made essential.
No.
Thank you. I was gonna say the same thing. I mean, people, and
hey, look how crooked my hair is. You see that line? I did it myself. Hey, I'm sorry. I'm living with my wife, who understands that as much as she wants to go and get her hair done, she just can't. And it's not a tough decision, Mel. It's the right one, and right decisions are never usually popular, even for landscaping. I have personal friends that operate just one-person landscaping companies, but I have to draw a hard line, and it is what it is.
You made mention, you made a comment earlier about we have a front line of defense. We are our own defense, and if everybody practiced the 5 tips that we put up earlier on the screen, and everything that you have been trying to do, if everyone practiced that, we would have 0 cases. I mean, the reality is this. Of course, that'll never happen because people tend to take things for granted. But we must understand. I have a question here as well, and I don't mean to put people. These questions are coming in off of Facebook Live, Mayor. But one person was, if an island resident goes to Oahu for chemo, would they still need to do a 14-day quarantine? And listen, right?
Yeah, absolutely. I mean, if you gotta go for chemo, and that's critical, they're quarantining anyway, because they should be doing their procedure, coming back and going straight home. And so yes, I mean, they already are probably practicing self-quarantining, and if they're not, they definitely shouldn't be going and getting chemo and floating around town anyway. In a normal situation, they should be resting.
That was exactly what my point would be. If you have any kind of autoimmune disease, if you have chemo, if you're a chemo patient, any of those, I mean, high blood pressure, diabetes, everything, you should not be out anyway. So obviously, you need to fly to Honolulu to get your chemo treatment. You should be on a 24/7 quarantine anyway. So thank you. I hope that answered your question as well. There was here, hang on real quick.
Mel.
Yes, sir. Yes.
And to underscore the mayor's point, Senator Harimoto has had cancer come back. He's been battling off and on for about 4 years now, pancreatic cancer, part of his lung being removed. And a little over a week before we adjourned, he had called me to say, because of what the chemo does to him and his weakened immune system, that he was already placing himself in self-quarantine. So for those who are going for medical issues, that's one of the things General Haro wanted to look at, to be sure you could get life-saving medical treatment. But to protect your own life, as the mayor has said, you should want to come home and immediately get back into self-quarantine, because you're not just protecting everybody else, but you're protecting yourself first and foremost.
Thank you, Senator. I know there was new construction and tax preparers. I think, listen, people, and the mayor is here as well, but understand that right now, and the numbers are growing and it's climbing and it's going to continue to climb. There is no evidence of community spread right now on Kauai, but we cannot take that for granted. I mean, the bottom line is we must be vigilant, and we got to really make sure that we stay away from people as best we can. So I think essential or not, everyone should be practicing these measures anyway.
Yeah, and the thing to point out is that this enemy that we're fighting is an enemy we cannot see, and I hate to say that it's an enemy because, well, okay, so the virus, and it's very sneaky. It can exist inside of a loved one for up to 2 weeks before any symptoms pop up. So for 2 weeks, that person could be walking around unknowingly, hurting loved ones, people that have taken care of that person for their whole life. And that's why when we put this wall up, we drew a hard line because we need this time to be able to see this virus emerge and really get an assessment of what we're dealing with, because the testing has not been robust. And that's a capacity issue that we all need to learn from, because this is probably not the last time this is going to happen. But what we have to keep in mind is that for this period of time, the story telling people stay at home. And so, a lot of the questions that came up is, well, why can't I finish this residential home that I'm working on? Well, one, we defined new market residential construction is non-essential. Affordable housing is essential, because the difference is we have no clarity if landlords are going to be evicting a whole group of people that have lost their jobs. We don't have any clear direction from financial institutions as to how deep we're going to have mortgage loan payment forgiveness. And so if and when we become in a situation where we have a mass amount of people that are being kicked out of their homes, affordable housing is going to be essential. So we are trying to do everything we can to get people to stay at home. And that's the question that people should be asking themselves. Instead of asking for exemptions, they should be asking, how is it best that I be able to be a part of this community-led effort to combat COVID-19? And the bottom line is to stay at home as much as possible. And the faster we can control this situation, the faster we can work on recovering the economy, because the economy will not have a chance to recover if we continue to get barraged by more and more sick people. That runs the risk of overrunning our healthcare system. And what people got to realize is that Kauai is used to having disasters, but we're used to having the other islands and the rest of the nation be able to support us. On this one, we're on our own. We're competing for the same ventilators that the biggest cities in the world is competing for. And we got to be able to take the burden off the front line soldiers in this mission, which is our healthcare workers, our first responders, public safety officers, even dispatchers, and keep them all healthy. Because when things really start going, which we haven't even started, like right now, we're building a bunker and we're telling everybody, hey, get behind the bunker and just shelter so we can see the enemy kind of pop out and we can move forward from there. If we lose our workers and we're burning through PPE like left and right, anytime somebody has to go to an unnecessary call, they got to put on N95 masks, they got to put on latex gloves, items that the rest of the world is putting a strain on the supply chain for. Like we cannot afford that. That's why we're very strict. And guys, I hate this curfew too. I mean, this whole stay-at-home thing, if you don't think I'm going crazy by watching rom-coms and all that stuff by now, like the faster we get out, the faster and better it is for everybody.
Thank you, Mayor.
Thank you.
I've been saying this for quite a while, where You got to treat this as if you and everyone else has the virus. That's the mindset we got to have. Treat it as if you knew that a certain store had a virus floating around in there that was a deadly virus, all of a sudden that mochi crunch or that salmon that you was going to buy is not that important. And that the mindset, and is what I'm trying to, many of us are, is like, assume you need to treat this as if you have it and everybody else has it. That's how you have to. This is not a joke anymore. That's not a joke anymore.
Yeah, and
Hey,
people
Mel.
have to be disciplined. Like what we're seeing here and what makes the biggest difference is some of these countries, they are extremely disciplined because they have to be. And I say we're still the greatest nation in the world because our foundation is based on freedom. So whenever you have some freedoms taken away, I understand the gut check reaction to be opposed to it. But in this sense, it's necessary because we need people to exercise self-discipline and self-governance on their own behavior and how it impacts our society at large.
Thank you,
Mel.
Charlie.
Yeah, I got a question. This is for the mayor or the senator. One thing that kind of disturbed me with regards to the reports that's issued on once there's a confirmation that we do have someone tested positive. Example was they're investigating the 40 individuals who came in contact with someone who is tested positive. I'm assuming, and correct me if I'm wrong, Mayor or Senator Kouchi, that 40 were names provided by the individual who was affected. Now, I know we talk about HIPAA, but why aren't they allowed to at least tell us places where the individual went, just so we ourselves know that, hey, is it possible I was in that location at the same time? Because now I could be a potential carrier.
So I can speak to that.
Yeah.
And I have to tell you that I've been equally as frustrated. And all of that information that you brought up is information that I don't even get. So the way that it works is the Department of Health will do their investigation with the confirmed positive. They will reach back to every establishment along that individual or group of people, every establishment that they may have stopped off at, and anyone deemed to have been able to be in close contact with that confirmed positive is put on that quarantine window of 14 days to see if any symptoms pop up. If symptoms pop up, they are tested. If they test positive, they're isolated. But as far as getting that information, I haven't been able to get that information. I can see where everybody's frustration is. And it's something that I don't have an answer for because that part of that whole operation is within the Department of Health. I can tell you that from our district health officer's standpoint, and you got to realize right now we're dealing with something that I don't think anybody has seen as far as the magnitude. She has been advocating for more information in a more timely fashion, but things have been slowed down significantly up top.
Well, I say that, and thank you, Mayor. But I think why I say that is because on Maui, if there's a shark attack, they tell you what beach the person got bit by the shark, so go to that beach. So everybody starts self-policing themselves, right? I think in this way, if they just gave us some knowledge, don't have to give names. They just said, oh, on this date, they were at a particular restaurant from this time to this time. As long as we know that, we can just basically say, hey, honey, weren't we there? Then that means, you know what? Let's hunker down and let's see if something's going to form on us now. At least it gives us a better handle of this. I think that's the only way if we're looking at controlling the spread, because the information now is you're only going to get what the victim that has the virus is going to tell you, that where he was. Okay. And that, to me, again, I guess that's what I'm saying is that's an honor system. Because other than that, you won't get any other information around that. And I can see the frustration, but thank you, Mayor. Thank you.
No, and that's a good point, and that's why at this stay at home, work at home, and what Mel said, to assume everybody is sick, because there's so much information that we don't have, it's best to assume that the virus is everywhere and people should stay at home. Bottom line, if you have to get groceries, go ahead and get your groceries, go home. If you have to get out and get some exercise, don't be silly about it. Get out, get your exercise, go home. Try to have as least amount of contact with anything besides being at home. And I know that it's hard. I'm very well aware that people are struggling and they're afraid. They're already living paycheck to paycheck. They feel desperate to get out there and work. But for the overall economy to be able to get the wheels turning, we have to just work with what we have and what we don't have. And all of those points you brought up is information we don't have. So my family, case in point, we stay at home just because we're assuming that these people that may have been sick may have been everywhere. At that point, that is the mindset that we need people to get into their head, is because we don't have information that everybody wants, just assume that the virus is everywhere. And the best place for you to be is at home, washing your hands frequently, maintaining social distances, don't touch your face, don't bite your fingernails. And that's where really the self-governance and the self-discipline comes in, because there's so much info we don't have.
Well, thank you, Mayor. And like I said, I share this info, and I'm sure you folks saw my videos that I released. My brother right now is fighting this thing in New York, and it's a battle that my other brothers and I, we're kind of worried. I mean, good things. We did get some good news, but it's not as much as we would like. And Mel, I'd like to share with who's ever watching that if they think this is a joke, it's not, because one day you can show signs of recovery. The next day, they're talking to you whether, we're probably going to have to dialyze him now because we got the virus contained. But then now it's cause other bodily functions to shut down, that type of thing. So this thing is just gonna, and I just take every day at a time, and I applaud you, Mayor, for what you're trying to do. But I think we got to get the message out, because today's a good example. I just went to just pick up some meals for the kupunas on our street, going on the street. I mean, it's frustrating. You see 4 guys riding in a car and they look like they're going for essential needs, drinking, driving. I see them pass right past the roadblock because the roadblock was setting up. But, it's stuff like that you kind of get irritated at, like, hey, we all doing our part. If we want to get past this, shut it down now so we can return back to normal life. But as long as you're going to goof off, life will never be the same as we know it. So thank you, Mayor.
Couldn't have put it better.
Go ahead.
I couldn't have put it better.
I think, and we get the 37-year-old bartender, Waikiki bartender, fighting for his life. We get many of our friends here, Dwayne Kong, I can say his name because the family has put it out on social media, fighting for his life. He's young. When this all started, the young people said, well, no, we don't need worry because, it's not going to kill us, and we cannot carry. Remember when this all started, if you never have symptoms, you couldn't be carrying the disease, but we now know it's not true. That's why I say we learn every single day with this virus because it's such a new thing, but it's no longer only for the old people. It's the young people. And I did invite my son and my daughter because they live in Oregon, and I have no idea even if they're going to respond because I didn't tell them that I would, but I want them to share real quickly what is happening in Beaverton, Oregon. What kind of restrictions do they have? There's my son right here. Let me unmute my son and let me unmute my daughter. Hey, Baron.
Oh, hello.
So what's happening in Oregon as far as restrictions? You guys on lockdown or?
Yeah, shelter in place right now. So you only leave for essential reasons, so like groceries, doctor appointments, or your work if you work. But like for me, I just been staying in the house. I'll leave to grab groceries or do some other things, but for the most part, I'm in the house. But they do pull you over if you are driving around to question you. But besides that, I mean, it's not like total lockdown, but it's locked down enough to where you know it's real.
Are you worried?
For me,
Remember,
because I can't work, like, so I gotta adapt. If I'm to be worried, it's about that part. But in general, I'm not worried. I don't put myself in stupid situations, but I'm not worried in that sense. Like, I'm not hanging out with friends or nothing. I think for a lot of people, like my peers, like my age, this is kind of the first big thing that's happened, and I don't think they're taking it as serious because I don't think they, in their heads, like, bad things don't happen in their worlds. So I think that's why a lot of people aren't taking it as serious as they should. But yeah, if we don't listen, it'll be as bad as you could ever imagine. So that's my 2 cents.
Thank you, son. You stay safe up there. We love you, man.
Yeah, love you too.
You're a handsome bugger. You look just like your dad.
Oh, actually, so Bryn, my girlfriend, she's actually working in a hospital right now, so she can give you kind of that scoop too if you want.
Is she there?
Yeah, she's right here.
Bryn. Real quick, Bryn, I know, congratulations. Just Paul, your residency. Are you official doctor now?
Thank you. A couple weeks. So
well, congratulations.
Thank you. It's a pretty crazy way to go out, but my last rotation is at Providence Hospital. So I'm in their outpatient physical therapy department right now. So we still get to see essential patients to make sure that their surgeries don't fail. All elective surgeries have been canceled for quite some time now. So we don't have many patients. We maybe see like 6 or 7 a week or so. No high risk patients, so no patients over 65 or with comorbid conditions. Over at the hospital, it's pretty crazy. They have like a 3-step check-in, so you can't even enter the hospital until you've been, they have like tents outside, 3 or 4 different tents. And so you have to kind of pass through these checkpoints, I guess. You have to be essential in the hospital. So like I think everyone's allowed 1 visitor, like 1 declared visitor. So husband, wife, whatever that is. My instructor's husband is a hospitalist over at the hospital, and they've been instructed to make sure that they have bandanas with them because they're running out of masks and protective equipment. They've had to send a lot of the acute care physical therapists home because they don't have enough equipment to supply them with masks and gloves and whatnot to see patients. So a lot of the doctors are having to be the doctor, the physical therapist, the occupational therapist, kind of everyone in one, I guess. So luckily the community has rallied around and helped as much as they can by donating equipment. Nike made a huge donation, which has been super helpful. They're having people sew like masks and cloth equipment that is able to be used multiple times so that they're able to provide the services that they can. But I think I see it in a pretty real sense being in the hospital every single day. And it's scary for them. It's way scarier than, than weekends at home feel pretty normal. We don't tend to go out very much anyway, but when I go to work, it is pretty real, and just can't encourage everyone enough to stay home. And you never know, they're saying at any given point, you're 2 to 3 degrees removed from it. So that's not very much in the grand scheme of things. So what we hope is that we're reaching the peak, but unfortunately numbers are exponentially continuing to go up. So we'll see what that brings.
Well, thank you, folks. And we're not near the peak here. And I worry that Hawaii is such a small place. Kauai is very small, and everybody. So yeah, it's real, and it's gonna get more real. So thank you guys. Thanks for jumping on, and Hang out. Somebody might have a question for you later, so don't go nowhere.
Everybody
Sounds
watching,
good.
don't be selfish. Stay home.
There we go. You sound like your mom, bro. Nikki, are you there, Nikki?
Hi.
So what? You look relaxed. I don't. What's going on?
I know. I am. I was just soaking in all the information.
So I mean, how's it affecting you guys up there?
Well, I mean, same for pretty much what Baron said. I work in the food industry, and so we didn't shut down completely. We moved everything to takeout. We changed like our hours of the restaurant and things like that, but I chose to just take a leave of absence and collect unemployment. But I've pretty much just been staying home, taking trips to the grocery store and things like that. The grocery stores are just kind of crazy. They've gotten to the point here where they've only allowed you, so I know other places is just like toilet paper and hand sanitizer and things like that. You can only get like 1 pack or whatever. But I just went to the grocery store about a week ago, and they're even limiting how many packs of meat you get. So per customer, you can get like 2 packs of any type of meat. So if you have a family of 6 or you eat like Hawaiians, you can't get that much food, and it's not going to last you that long. But it's getting to that point where people are just going into the stores and clearing everything out, where there was just no food for anyone else. But yeah, I mean, other than that, I feel like everyone's kind of going crazy and just staying at home. The roads are kind of empty. We have a normal, like back home, you have the traffic going into Lihue or going into Kapa, things like that. We have that same kind of traffic going into Portland around, that rush hour time. And I did that drive one day and it was just empty. So, I mean, hopefully everyone it seems like people are listening. However, I know a couple weeks ago, or maybe a week ago, once they implemented the social distancing and things like that, people kind of went crazy, and they all decided they were all going to go to the beach, and they're all going to go to the waterfront, and they were all going to go and do these things. And the mayor saw that, or the governor saw that, sorry, and she went kind of crazy and got really upset. And that's when she went more into this lockdown type of thing. And
That's I mean, people think we got it rough over here, and it's people like that abuse. They go out and they hang out, and they go to the beach and hanging out in crowds and parties. They're gonna make it rough. But the bottom line is you gotta protect yourself. You gotta stay at home. I like the way, Nikki, you're practicing don't touch your face. I like the way you do that. You shouldn't be touching your face. But anyway, thank you, both of you. Stay safe up there. And we love you guys. Just we want to make sure you guys okay.
So Mel,
Yes.
Baron, Nikki, take care up there, because I mean, you guys are seeing a much more dire situation than we're seeing right now, but it could very well end up here. And so I'm glad to hear your perspective on it, especially from younger folks like yourself, because there's a number of younger people out there that still think that it's a disease for old people. But let me remind people that coronavirus is a virus that mutates relatively easy. And so there are already 2 strains that have been identified. And what's not clear, at least from Department of Health, is whether or not one of them is indeed more severe. But we do know that 2 strains do exist, and we're seeing random younger, healthier people fall very ill. And so I think it's another reality check. And Mel, I gotta take off in a little bit, but I did want to point out that many of these rules we put out, say for example, because we have so many moving pieces that we have to consider. for people's mental health during this time of stress. We wanted to make sure that we had openings for people to get out there and exercise in a limited capacity if they can maintain social distancing, walking their pets. You know, even golf, you know, golf is a sport that we felt of all sports is a sport that where social distancing is already. But what I'm seeing out there is a lack of discipline from golfers. And golf is a sport that's built on integrity and honesty. You keep your own score. And so what disheartens me is when I see, and it's always just a few bad apples. I'm not, you know, painting a picture for all golfers, but if these few bad apples cannot self-govern their behavior, and if they cannot have the type of integrity and discipline to practice social distancing, hey, this is another thing that's on the chopping block as far as, look, we tried, it poses a risk. Do we have to consider pulling that out? Just like surfing as well. Surfing is a sport where you should be able to maintain social distancing, but if everybody's at one peak, all sitting on the box, all still trying to compete for waves, because surfers, just by the nature of it, we're selfish people. We try to catch as much waves. If surfers and people from the community that I belong to cannot have the self-discipline to say, look, everybody should be able to catch some waves, space out, sit out in the channel, you know, you catch a wave, don't just paddle right back to the peak, then I'm gonna lose something and we're all gonna lose something because one, it's starting to pose a risk. And that's what I try to instill in people. Like, government in this case cannot babysit everybody. If we feel that that's something that we allowed to do is going to pose a risk, I'm not going to think twice about clipping it, because right now, the rate that this virus spreads, I don't have time to think twice. And right now, I have no concern about being in a position to make people happy, because that's not my job as mayor. My job is not to make people happy. It's to do the right thing. So I'm asking people before I depart, please, if you see friends out there, remind them. I knew this is new and we've never had to do this, but things like golfing, things like surfing, I mean, if people continue on their behavior that they have been, and we continue to see numbers rise, which we will, I won't think twice about just saying, well, look, we tried, people couldn't be disciplined enough, and we're going to put it on the back burner until things look brighter. And so we want to allow for some sense of normalcy, but if people cannot self-govern, then so be it. You know, we tried.
Well, Mayor, thank you very much. I mean, and I hope you get, I just got one more question just came in on Facebook, but I just want to say this right now, you know, we had over 500 people on Facebook. This thing will be shared and it'll go viral. Listen, fair warning from the mayor, fair warning. He's been generous to a certain extent. That's at risk if you guys don't pay attention and listen. Fair warning, people. So you guys want to go mess around and ruin it for everybody, go do it. But anyway, thank you. So here's a question. I'm going to read it right off of Facebook. Question for Mayor, if it hasn't been answered. In Wuhan, positives were forced or mandated to quarantine outside of their households, away from the family. They set up large facilities for COVID folks to avoid the spread to family members, which reduced clusters of infections. I understand that this would not be popular here, but has this been considered? Is it even possible? Maybe discussions can be started with some of our empty hotel properties to accommodate this need.
So that's a very good question. Whoever posed that question, I want to thank you. And
Stan Koga.
Oh, Stan, hey,
Stan, yeah.
Enjoy your retirement and stay at home. Anyway, you know, we have considered it, especially since in Hawaii and on Kauai, the cost of living has forced us to live in close quarters as far as multi-generational households. We do have an isolation facility. If people feel that the house is overcrowded, the isolation facility is certainly an option, but the capacity at that is limited as well. As far as hotels, we've had conversations about them being a quarantine facility. So that discussion is ongoing. But if you're flying in as of since that mandatory quarantine came in, you're getting quarantined at your resort destination anyway. So what we've done is we do have very clear-cut protocol for anybody that's in quarantine and isolation, that if that family and that household follows the instructions on that protocol, it really reduces the risk of anybody else getting infected. That means having food dropped off, that person is not in contact with shared spaces. And I understand that in certain households, that is extremely challenging to do. That's why we're telling people stay home, so you don't get sick and you don't go home and get everybody sick. And it comes back to that point with all the questions that we do have and all of the limitations that we have. People have to understand that is why we're drilling home over and over and over again. Stay at home, stay at home, stay at home.
Are you there, Derek?
I am. Can you hear me?
Okay. Oh, no, I shared the screen at the same time you went silent. I thought, oh my God, I hope I cut him off.
No, I mean, all I gotta say is stay at home.
That's it.
You know, like don't try to get away with things. Like don't try to, you know what I mean? Like tell guys, oh, I'm gonna go to the grocery store and then go hang out. And, you know, it's like, hey, we understand that you gotta live. We understand that if you're an essential worker, you gotta work. We understand that you gotta move, but limit that movement. Right now, that is the best first line of defense, is your own personal behavior, your own personal responsibility, and your role as a member in our society to be concerned about how your actions have unintended consequences on everybody else. Be considerate. I mean, that's what we've seen. I mean, you know, my wife is a schoolroom and a classroom teacher, and she can't say it, so I will, but we're grooming a generation of people that doesn't have consideration for others. And right now we need to reinstill those foundations and that type of discipline that has been lost over the years. And this is where we need it the most.
And, you know, nothing happens by accident. Maybe that's what this whole thing is, why it's going on. Derek, real quick, you know anything about Princeville Airport? Do we have anybody set up at Princeville Airport for planes that land in? I'm sorry?
To do what? For
the people coming off of the planes at Princeville Airport. Should there be, I believe it's only a small commuter plane that goes between here and Honolulu or the outer islands. So
everybody coming in from out of state is mandated to do a quarantine. And we're trying to get that mandate imposed on all arrivals. Quite frankly, things have been moving slower than what I would want it to be. And that's me being restrained as far as how I truly feel about the situation. But it's not rocket science. And it should be done immediately. And like I've made the point time and time again, you know, in this case, the counties are always in the trenches. And when it comes to a disaster, they should understand that we should be governing the situation and we should be getting support services from the state. So I say, let the mayors govern, let us have the authority. And we need the state. We definitely need the state, but at this time, we need the support services as far as being able to let us make the hard decisions, because I can understand that they may be hard, but for me, it's very easy. It's about protecting this island and our people, and that's it. It's not about making people happy. We can fix the economy once we get out of this situation, but it's hard to do both. You have to pick one.
Well, we appreciate what you're doing. I know you got to run, and you not only the virus, you got hit with the rains and the flooding and the disaster within a disaster. So appreciate you and your staff, and really happy what's been going on, sir.
Hey, we're going to try our best. And, you know, it seems like the whole universe is trying to throw the whole kitchen sink at us. We got the best team, folks. I want this island to know that I have supreme confidence as far as everywhere from our state delegation, I mean, I couldn't be more blessed to have a team at the state that has put their trust in me, have not bogged me down with demands. Hey, they're getting the communication the same way everybody else is. Like, I don't have time to brief them. Like, they're waiting, you know, on Facebook to see what our update is going to be. Our county council has been very supportive. Senator Schatz has been in constant communication with us. And the team that's in this EOC, we're in it for the long haul. We're gonna be here grinding away because that's what we do. And we have the very best to collaborate this very complex situation. Mel, I wanna thank you for inviting me onto this platform. To everybody that's been able to listen in, thank you for your time. And you know, if I have offended anybody, or if I have put on restrictions that you are upset about, I understand. We will take all opinions into consideration, but at the end of the day, I need to make a decision based on the information that I have and I don't have, based on protecting this island and her people. That is the main thing on our mind at this point in the mission. All right, so everybody stay at home, wash your hands, don't touch your face, maintain social distancing, get your exercise, go get your food, go home. Okay? There's a whole bunch of movies out there, and we can get through this. And we are gonna get through this. And everybody take care. All right?
Right on, Mayor. Thank you so much. Apologize again for the last minute. We'll chat soon.
Thank you.
Thank you.
Thank
All
you.
right, real quick, I got one question over here, a hand raised from Jody. Jody, did
Hey,
you have a question?
yeah, a
Yes.
couple, sorry, I jumped on really, really late. I didn't know this was happening. A couple of questions in regards to airlines. Do we have now big carriers coming in, Delta, United, any of them?
They're still
Still?
coming in, most of them coming in empty, but you know, that's one of the discussions we had earlier about getting accurate information regarding how many
concern
visitors are arriving.
And my questioning is, as you know, is the crew, the flight crews that are coming in and staying at these hotels. You know, because I'm looking at, you know, we talk about our hospital people and our nurses and our doctors being front line. You know, I'm looking at hotel being second line because they're in a place where they're not prepared to be in proximity. You know, it's not a part of our training to be around people who are could possibly, like, you know, be carrying something. And where are the protections and guidelines for that? You know, front desk has a desk in front of them, but anyone else at that point, you know, these people are moving around, and what is being looked at on that point, you know, because like I said, flight crew, they're you know, they're around people constantly and coming from Lord knows where, you know. I mean, has that question been posed as well?
Yeah, and the flight crews are screened. They get their temporal scan at the airports before they leave the airport. That's the extent of the screening at this point. Again, very little passengers actually coming off of the flight. I know I saw Khalil Perez here earlier. It looks like he left, but he tells me that it's actually very few people coming off at Lihue Airport. My concern, as I said earlier, was the ones that are coming off in Honolulu, getting on Air Island and coming here. But Senator Kouchi has assured us that they are being screened, not medically screened, but they are being stopped at Honolulu. Their information is being obtained, and the tourism authority or whoever is making the connection with the hotels to make sure that these guys are actually going where they said they were going to go.
I actually had another question. Sorry. The other question with regards to, he was speaking about evictions. Now, you know the situation here. Now, is in regards to moving, you know, is that considered? You know, if say, for example, you know, people here that are getting evicted are, you know, do locate something somehow, you know, that's a lot of movement that takes place with people needing to come in and assist and all of that. Yet there's that questioning, if I don't act, am I going to lose this spot? You know, so where does that come into play? You know, if I decided to move, would I be in violation of what's essential?
Well, and I think moving is, if you got to move, you have to move. Again, you know, it's the rules of engagement is what I call them. The social distancing all take into account. You gotta practice all of that. If you don't have to move right now, definitely not move. Evictions, you know, the governor has stated that he has suspended the landlord-tenant law, but that doesn't reach, and maybe the senator can help me with that. You know, that doesn't. Evictions, that's a process. It's a civil process that has to go through the court system. So it's a minimum 45 days before you get booted out, and then it's a whole court process. So unless you're in the middle of an eviction that the deadline is coming up, I just cannot imagine that any judge would order you to leave. I think at this point, stay in place as long as you possibly physically can. Senator, you got any additions to that as far as the governor's
I believe they'd suspended the foreclosures as well as the evictions. So, you know, you're not supposed to get evicted right now. You're not supposed to have your property foreclosed on. And I do have a couple of quick things, Mel, before I have to go.
Okay.
I did see one of the questions about dialysis patients. I just received something from the Kidney Foundation today, and I forwarded it on to the governor's chief of staff, and you know, we're getting General Hara to look at it, but I believe they indicated there are 3,400 dialysis patients statewide. On Oahu, I think that they use the van for 1,400 of those particular clients, and it's not equipped to transport anybody who tests positive. And so we are trying to find out as well what could be done to get transportation for some of these people. Also, if you know you're quarantined, and so we're hopeful that this is a cost that FEMA could assist us with, you know, as far as talking to the amount of money that has been expended by the county governments for first responders, all of the overtime, people in the EOC, you know, and other essential services. We are looking in, and that's part of the conversation with Senator Schatz and Senator Hirono, you know, what might be of possible help for the counties. The stimulus bill, though they did make clear, is for only COVID-19 related expenses. If you watched Governor Cuomo at 6 this morning on his daily address, he was bringing up the fact that they're not giving money in this current budget or stimulus bill that is plugging the revenue holes in all of state and county governments' budgets. This again goes directly only to COVID-19 related expenses. Between coronavirus, COVID-19, you know, trying to get it right. I saw Lorna had asked the question about, is there a vaccine yet? No, there's not. So whatever rumors that you hear or headlines that you see, they've not identified one yet. Normally, it could take 18 months to 2 years to get through the whole clinical trial process. If you listen to Dr. Fauci on his daily talks, he will continue to talk about, we have another one going into clinical trial, but they are trying to get an expedited 6-month process through, you know, the Food and Drug Administration. But the clinical trials are exactly what they say. It's simply people who are getting the drug and people who are getting the placebo, and to see if in fact the drug is having a positive effect on the individuals taking it. But it does take time to see what is the net effect of the drugs. And then back to what I had mentioned about Representative Tokioka. I believe he was here Friday. Again, he had hired Bruce Smalling. He did video the process of visitors and residents coming off the plane, what was happening and going on. I believe he went to Wilcox Hospital to get some information about what's happening at Wilcox Hospital. I'm not sure who else he was able to talk to and film, or if it was those two items in particular. And he's hopeful by later today, certainly tomorrow, that you would have Kauai COVID-19 update, and it should be available on YouTube. And you can see firsthand by the video Bruce shot with Representative Tokioka what's happening at the airport and for sure at Wilcox Hospital.
Awesome, awesome. Thank you, Senator. I'm just going to go rip through these questions and then we'll open them up. Do we have community spread here? The bottom line is, as the mayor said, there is no evidence of community spread here on Kauai. It is evident in other places, but it's just a matter of time. Now that we have residents, the number of residents that have the virus outnumbers the number of visitors that got the virus. So community spread, in my opinion, is here, and it'll be here for a while. There's still a lot of people driving around the west side. Exactly. That's the problem. People not taking this serious. We got to let our family and friends know to stay home. As the people out there as the people who are been in contact with the person who got tested positive from Vegas isolated, we know that the person that did test positive is isolated. Unfortunately, the rest should be in quarantine. There is no way of knowing, and that is the problem. It's a self-quarantine. So, and that goes back to what Charlie asked earlier about why don't we get the information? And I think that was made clear by the mayor. Why aren't we getting information of where these people have been? And we don't need to know their names. We don't need to know what their address is. But we do need to know, were they in Walmart on Thursday between 11 and 12? Or were they at Jack in the Box? Or wherever the hell they may have been, we should be able to have that information. So all I can tell
Mel,
you is that, yeah, go ahead.
You know, to the person, addressing that person that asked that question, I go back to your scenario that you taught me with, and that's a very, very good scenario. If we all can think that once we get a shark attack, you don't just put out the news that a person got bit on Kauai, because that's useless. You tell what beach they got bit at, so everybody avoid the beach, correct?
Correct.
Or you know, at least make a sensible, come to a sensible conclusion. That's the safety factor. With all of these people coming in right now, and if they do test positive, they don't know if they passed this person in the hallway or whatever. But if they know that they was at this special restaurant, they can at least say, I was here. And then if we attach ourselves to the information, we can start saying, hey, I was there too. So that's where the link up, because if we're trying to stop the spread, and you know, both you and I were police officers before, you have the regular patrolman and you have an intelligence section. And what it is the intelligence is going to gather more information that's deep-rooted that usually patrolmen will not have opportunities to get. That's what we got to get to fight this thing. We got to get deep-rooted information and equip the people with it so they can make it, they can take that educational process and just say, damn it, I was there. I think I'm coming down with some symptoms, not to get shell-shocked, but at least try to eliminate the variables and then just say, hey, I'm negative. Okay, fine, good. But right now, it's not happening now. It is not happening.
And that's why they need to provide that information. You know, when the Senate had the committee hearing a few days ago, they asked Bruce Anderson and Dr. Sarah Park, and they tried to say it was a HIPAA issue, that it was a HIPAA issue. But we know that's not a HIPAA issue because you're not revealing anybody's condition with a name. That's not a HIPAA violation. This morning on the news, Dr. Scott Miskovich, he's the senior advisor to the governor's health or the lieutenant governor's task force. He said basically that decision is up to the incident commander, General Hara. The fact of the matter is they don't want to see people get ostracized because people found out that they were positive. Like really, you know, they're going to be ostracized if they're found to be positive and they're gallivanting around the streets infecting people. But if they're home in isolation, people are gonna pray for them. They're gonna be thankful that this person is in isolation. So it's not a HIPAA issue, and that's again part of the problem is the misinformation that goes all over the place. You listen to one person at the state talk, and then you listen to another one, you get different information. The bottom line is this: that decision is up to General Hara. I happen to believe, like you, Charlie, that this information is vital. Yes, if we all stay home all day, and if we all go to social distancing, yes, it's going to be very difficult to catch. But you cannot stay in your home 24/7. You got to go to the store. So you, as a citizen, should know if in fact an infected person was in the store that you were going to go to. That's our right. So anyway, it's frustrating. Is KPD checkpoints to check on tourists? It's to check on everybody, but it's to check on the lockdown, not on the quarantine. So that's just, again, making sure that people are not out and about for no reason. And again, the quarantine, really, we got to find a method to effectively enforce the quarantine. Let's see, hold on here. If 3 men are, if and when, I can't read my wife's writing, sorry. Went to the store with wife and stayed in car while she went in and noticed 5 couples in 10 minutes. Is this okay? The recommendation is 1 per household. That's a recommendation. So again, people, use your best judgment, and stay safe. Felicia said to address the evictions. That was addressed by the senator. Thank you. Need to make unemployment easier. They have brought in more servers. They got some cloud storage. They also have a telephone call center now, so you can apply over the telephone. Yes, we got thousands. I understand we're over 80,000 applications for unemployment now in Hawaii. That was of last week, so it's probably even more. So we just got to be patient, people, and gotta let that process go. Remember, this is unprecedented. So let's it should be working smoothly now, from what I understand. Anyway, these applications are going right through. Why is affordable housing essential and new homes not? I think you heard the mayor explain that it's important to get these people into. Whether you agree or disagree, that's his opinion. That getting the affordable housing homes up is important to get people in crowding situations into their own homes. Why are non-residents allowed to deplane? Because we live in the United States of America and we have a constitution, and there has been no order to stop the flights. Okay, hold on. What about people coming through Princeville Airport? We made that. Is home renovations considered essential? No, I think the mayor explained that as well. How can we get food handlers to use gloves? You know, again, there's certain things that different levels of authority has. When you go into a private establishment, then that's a private establishment. If you are, I would not buy food from a food handler that wasn't wearing gloves. That's simple. I just wouldn't. So use your best judgment. There's no way that the mayor or the governor is going to come out and make a law that says all food handlers got to wear gloves. I mean, that should be, I can't imagine who's not wearing gloves. But again, use your best judgment. If you're not comfortable, don't go in there. I honestly am quite disappointed with the promotion of all of the food places, just in my own opinion. And I support small businesses, yes, but you know, while everyone is so strict on stay at home, but allowing people to go through these restaurants to go pick up their food, there is a certain threat and compromise in that. So, but that's not the case. It is okay to go through these places and pick up your food, do takeout. But again, if you're uncomfortable, don't go. Just go somewhere else.
Hey,
or
Mel.
stay home and make your own food. Yes, sir.
There was 2 places, and I want this for your viewing audience here on Facebook to, you know, support business. As you know, in Waimea, my wife and I, we try to visit all the eateries, because when everything settles down, we're hoping that all the eateries will stay in business. But for the time being, you know, we're visiting all these places. But you know, I'll name 2. And this is not an endorsement, but I'll just name 2. One is Uncle's in Hanapepe and Kaleo Steakhouse. And I saw firsthand, like this, whoever wrote that question, I saw because you get a perfect view into the back of the kitchen, you know, the people that's handling the food. And I saw everyone wearing gloves, which I'm very happy with. That's why I will go back and give them business, because I see what they're doing. I put it on Facebook today, even at Uncle's, to thank you in this time of hardship. You buy food, and they also put in one roll of toilet paper as their way of saying thanks, giving back to you. I mean, How special is that? Because hey, toilet paper is something that we all need and we can't find. So, you know, I think they're being creative. But to answer the question, these are just two of the places I've been to so far that I've seen food handlers using gloves. And I'm very, very happy with that. And I wish more.
Thank you.
I wish more would do that. Yeah.
Yeah, I mean, you know, if you're a restaurant owner or a food establishment, I mean, I would do everything in my power to make sure, not, and you know, for the customers, but for your employees as well. You know, for your employees as well. Common courtesies to self-quarantine, absolutely. I mean, I think that's what we'll talk about as we wrap this up. What happens if you fly to Oahu for treatment? We talked about that. If you're going to Honolulu for treatment, you should be on a 24/7 quarantine anyway. I mean, this is if your autoimmune system, we've talked about it how many times, is if you're vulnerable, if you're old, not so now, you can be young, but the bottom line is if anyone is vulnerable. So if you are in a high risk group, diabetes or high blood pressure, heart problems, or if you're being treated for cancer or recovering from cancer, or even if you beat cancer and your immune system is reduced, then you're at risk and you should be at home anyway. You should not be going around. Please, people, listen. Many people staying at I don't know what this vacation rentals, not at hotels. Absolutely. And again, it all comes down to the enforcement of the quarantine and how we're doing that. And we're far from being where we should be. And I'm hoping that this governor takes it serious. I put up a suggested plan a few days ago where you put a bracelet or a little bracelet that cannot be removed except with a special tool that the state would cut it off on your way out. But people gotta be monitoring, not calling them on the phone. My suggestion was you activate the National Guard and have the National Guard take over all of the quarantine security, which means you will go to that hotel room and you will make sure that they're physically in the room. And if not, then you get cited and fined. And if they continue, you get arrested. So anyway, we haven't seen that yet. Delta Airlines not screening. I don't know about that. I cannot answer for that. I'm told that all of the crew members from these flights are being temporal screened and all of that. I'm not sure where that came from. Temperature screening not accurate. Again, that's the best we got right now. You know, if you look at the best case scenario, we stop all the flights. That hasn't happened. Next case scenario, you do a full-on mandatory quarantine lockdown. Yeah, we did that. But number one, we waited 5 days. So there's a whole lot of people still on this island that never quarantined, depending on how long their vacation was. And then you get the ones that are coming in now. Some of them are avoiding or evading the quarantine process because they're coming in off of airlines, inter-island airlines after hubbing out in Oahu or Kona or Maui. We got a lot of people around that could be carrying this virus. That's what I'm trying to say. And that is why we all got to be careful. You know, I'm trying to find, I thought I had it up here. Hang on real quick. That's all right. You guys all saw the numbers. Kauai is rising. It will rise more. It will going to get more. And, you know, unfortunately, statewide, we're gonna start seeing some people pass away from this virus. It's going to happen. We're no different than New York. We're no different than Washington State. We're no different than any other state in this country. We are actually, I believe, more at risk because we have brought in many more people outside of our state over the last few months. We don't really know when the virus got here. By the time we found out, it was already rampant in other countries. We know we're behind Washington State. We know we're behind New York as far as time. We got a couple weeks behind. So when you look at their trends, you can basically expect to see similar results. So our numbers are going to rise. If we can practice the safe examples that we talk about, the washing hands, no touch your face, all of that. If we do that, if everybody does that, there's a good chance our numbers can be reduced tremendously. And that is exactly what we got to do. And that was the message. You know, I'm really thankful that we got everybody on here. I don't think we have too many left, but we still have a whole bunch of people on Facebook Live. And I do want to thank all of you guys for being on here. But the whole message for today really was about that, was about, I talked to Charlie about doing this and I said, we want to get past today with people knowing that it's so vital and so important that we social distance, that we stay at home, that we wash our face. I mean, we don't touch our face, that we wash our hands. It's important. And when you see people out there, groups and congregations, call the cops. When you see parties at a house, call the cops. You don't want to be a nasty neighbor, but you also don't want to see people die because you had nasty neighbors. I think this is a time where we got to be strict on everybody. I'm so concerned about this virus. And I think a lot of people are still taking it too lightly. No matter
Hey,
what
Mel,
the man says.
one thing they can actually take a look at, we have the studies that show what vaping has caused, right? Lung damage, correct?
Mm-hmm. Yep.
But it's a tangible object that you can grab onto that I'm not going to get them, but then you put it right up to your face and you're actually taking a chance of running the risk, correct?
Yep.
So up to that point, that is something that everyone can grab onto. With this virus, you can't see it, you can't smell it, you can't taste it. So you won't know until such time as you find yourself actually having a difficult time breathing. That's the whole thing. Or having a sore throat that just won't go away, or having a fever that just can't be controlled. My brother had 102 fever and he just could not break it.
Yeah.
He just could not break it. So I hope anybody that's listening to this, please, this is not a time to be a test subject, see if you can outrun this thing or not. Because if you're anywhere near it and you catch it, you're not going to outrun it. Plain and simple.
This is what it boils down to. 175 cases in Hawaii. We still got 6 pending. We don't even know what island they're from. We do know that Kauai now has 12, and that was as of 12 o'clock today. So, and if this is what I wanted to show you guys. This is where we're at. 7 residents, 5 non-residents. We had 1 more resident from yesterday, 0 tourists. See, we're running out of tourists. Very few are coming in and a lot of them are leaving. So we're running out of tourists. We cannot blame the tourists anymore. We cannot blame the tourists and the flights and all of that anymore because they're not coming. They're not coming. So community spread, once we get community spread going rampant, that is where we see the exponential growth. That is where we see people that we love die. I hate to sound like that, but that's the bottom line. When this thing spreads in the community because some jackass decided to go to the shopping center or decided to go and hang out with friends, go have a couple of beer, do a wine tasting, whatever you guys do, and spread that virus. And then that virus spreads to the next. You see, the average person with this virus spreads it to 2.5 to 3 people. That 3 people, average 3 people, that becomes 9. 9 becomes 81. You understand how quick this thing grows? That is how New York is blowing up. See, we have a chance because we're still, we're going to get more numbers. Don't think that we're going to end up through this crisis with 100 cases on Kauai. Oh no, it'll be much more. What I don't want to see is anybody die. That is what I don't want to see. Well, everybody gets it, you recover, and we learn from it, but we can stop that. We can limit that, but we got to be disciplined. I think that is the bottom line. Anybody else? Let me look if anybody else had their hands raised, because we're going to be wrapping this up. Anybody want to say a few words before we get out of here? Ed McDowell, you want to say a few words, Ed? Raise your hand. Let me see. I'm going to unmute Ed anyway, because I just want to hear him. I don't know if he's going to let me unmute. Ed?
It's still muted. It's still muted.
Yeah, he don't wanna. Any other questions? Anybody got any other questions? If not, Charlie, any last words before we end this?
Well, I'd like to say thank you very much for your this forum here, getting the word out. I mean, if we can reach the multitudes, then that's the way to go. In this day and age, use a video conferencing, do whatever we can, but I think it's frustrating because when this is all said and done, you ask yourself, what the hell am I supposed to do just short of shaking somebody uncontrollably to get them to understand what we're trying to say? You know, whether who's ever out there in Facebook land, just know that I love you. I love you enough that I'm putting my face on this to tell you what I'm experiencing now. And imagine this, I'm thousands of miles away from my brother. I can't go jump on the plane and go into a hot zone like New York to go see him as much as I want to. Because when I come back, I'll probably bring something bad back. Do you want that? No. So right now, we just gotta stay put and just practice being safe. Because mankind as we know it, if we don't practice being safe, it'll eliminate itself. And you know, I still got grandchildren. I got my young babies, and I want them to live. That's all I can say. I want my babies to live, because you know, they didn't ask for this. It's just that they're thrust into this BS right now. And I want them to survive. I want them to live a happy life, even when my wife and I have left this planet. I want them to live. And it can't be that way if this thing keeps on going around, and people got to do their part. Thank you. Thank you, Mel.
All right, Charles. Thank you very much. Again, last chance, guys. Last chance. One, twice, gone. Okay. Well, people, again, appreciate you guys taking the time. I want to thank Senator Kouchi, Senator Kahele, Mayor Kawakami for taking time. Again, I only let them know a few hours ago, so they stopped their schedule to join us. I hope we got most of your question answered. I get a lot of questions. If you have questions, send them to me in Messenger. As you can imagine, I have thousands of messages now, and I'm trying to get through every one of them as quick as I can. So bear with me on that. But yeah, shoot me a question on Messenger, and I'll try to get the answer. If I cannot answer it, I'll try to get it as quick as I can. Aside from that, everybody, it's after 4. My God, we went well over 2 hours, longer than I expected. Appreciate you guys' patience, understanding. Stay safe, people. Stay safe. Take care. God bless. We love you guys, and we'll see you guys on the next one. Aloha.
Aloha.